This is my audience. They make me show you guys for like 4 seconds. How well do you know your mouth? That might seem like a funny question, but it's actually very important that you're familiar with both your mouth and your teeth in order to know how to properly care for them. That's why regular dental exams and cleanings are extremely important for your oral health. According to an article from PubMed, dentists in the early 1800s would use beeswax to take impressions of their patient's mouth and teeth. I've been a dental assistant for almost 5 years, assisted multiple dentists, used all different systems and materials, but fortunately I have never had to take an impression using beeswax. There are many tools and examples to use when it comes to patient education and monitoring oral health. Today I will show you how to capture an oral health scan using the iTero Lumina. This scan is a 3D impression. This impression can serve as an educational tool, preventative care, and be used to fabricate any dental appliance the patient may need. Let's discuss how this scan is incredibly useful and how many different things the digital scanners themselves allow us to do for our patient. This is the way of the future. First, let's talk about a few different dental scanners. I've personally worked with iTeros and Medits. In our office, we have 2 different iTeros. We have the iTero Lumina and an iTero Element. They're both a little different, but also similar. They both are capable of scanning for oral health scans, removable appliances like dentures, night guards, ortho retainers, and also scanning patients for crowns and implant crowns. However, I personally favor the iTero Element when scanning patients for crowns and the iTero Lumina when scanning patients for dentures. I've also used a Medit scanner. The Medit scanners are software that you're able to install into like any gaming laptop, and it comes with a wand to scan with. I don't really love the quality of a Medit scanner. It does not compare at all to the quality of an iTero scan. The one thing I did like about the Medit was the size of the wand. I think it's a lot more small and comfortable for the patients when we're scanning their teeth. Let's go ahead and use our iTero Lumina to take a wellness scan on our patient. Before you start your scan, you'll need to make sure that you have a new clean tip on your scanner wand. Then you'll want to make sure that you filled out all of the patient's information correctly, where you'll be sending the scan to, what you're scanning for, and when you want it back. Today we're only scanning for an oral health scan, so it will just be saved into the patient's record. Next, you'll want to dry the teeth. Some people use an air water syringe. I prefer to just dry the teeth with cotton. So I'm going to dry the teeth, and then I'm going to start on the occlusal surface or chewing surface. Once I've picked up enough of the occlusal surface, I'm going to roll the wand onto the lingual or tongue surface. Then I'm going to roll the wand back onto the occlusal and onto the buccal or cheek surface of the teeth. The iTero Lumina does not want you to touch the teeth, but to hover over, unlike the iTero Element, where it wants you to touch the teeth. After I've captured enough information for the lower and the upper, I will then have the patient go ahead and open and bite down, and I will capture their occlusion or their bite. After that, I will have the scan process, and then usually I will send it where it needs to go. But since it's just a oral health scan, we are just going to save it for the patient's records today. Now that we're finished scanning, we can educate the patient. Educating patients is the most important part for our day-to-day work life. They say that people need to hear things 7 different ways, 7 different times. Fortunately, with these 3D scans the iTero lets us take, we're able to show the patients the state of their mouth. Seeing is believing. When patients come in and they need a lot of work done, we're able to take a before scan, finish all of the work they need done, and then take an after scan. Patients are usually in awe with the change of their mouth and their health. Dentistry has so many different aspects and techniques. Today we have discussed a rapid growing technology in today's dental practices that I am grateful to use in my day-to-day career. We've discussed a few different scanner types, the efficiency of the scanners, and the ease they create not only for us, but also the patients, and how we're able to educate the patients on their oral health. Digital scanners are the way of the future. They are not only fabrication units that allow us to make appliances and restore our patients' teeth, but they also serve as educational tools. Fortunately for myself and my patients, we will no longer be using beeswax. At your next dental visit, ask your dentist how they can help you get to know your mouth. Thank you.